I'm the Trauma Program Manager.
I'm Melissa. I'm a nurse here in the ED.
Today we're going to discuss how to set up a chest tube. So it's important to know that both rooms, 37 and 38, are set up exactly the same with Omni-cells on both sides, and each Omni-cell has a section titled chest tube. So the main supplies that you're going to need for the chest tube are in these upper two spots of the Omni-cell. It's also important to know that we have a chest tube checklist mounted to the inside door, so that when a provider asks you to set up a chest tube, you can simply open the door, look at your list, and set up all of your supplies. We want you to do this the same way for each provider, regardless if it's an ED physician or a surgeon, so that we can get the same standard work down. So most of your supplies are right here, along with your PPE in this section here and your sterile gloves. It's also important to note that for all these procedures, you're going to need a surgical consent, which is kept at the head of the bed in each rooms, 37 and 38, titled surgical consent. So it's also important to know that if it's an emergent procedure, informed consent is implied, and this can be taken care of afterwards. So once you grab your consent, you need to make sure that you put a patient label on the consent so that it gets in the right patient's chart, and you would just simply want to leave this sitting over to the side of the bed for the surgeon. So once you get that, it's also important to know that you usually want to have two bedside tables so that you have plenty of room for all of your supplies. So Alyssa's going to demonstrate exactly what to pull out when you're asked to set up a chest tube. So you're going to start, when they ask you to set up a chest tube, with grabbing your chest tube tray. When you get it out, you're going to want to put your instrument tray on one table and go ahead and open it up, and you're going to want to put the chest tube envelope, which is the plastic bag with all of your goodies, here on your second table. And in this plastic bag, you're going to have your lidocaine to numb the patient, syringes, needles, and also your sutures. So you want to go ahead and just leave that to the side and leave your chest tube tray to the side for the surgeon to open up. And then you're going to start pulling out all of your supplies. You're going to do your chest tube, your chest seal chamber, atrium, your 2-inch silk tape. This 2-inch silk tape is to secure your connection sites for the chest tube, which is incredibly important as soon as it's placed, and also to secure the chest tube to the patient's side with gauze, 4x4 gauze pads, and then your silk tape. Your bottle of sterile water, or you can also use normal saline to fill your chest tube atrium. Your large tinted core prep, so it's very important that you select the right core prep. They should be stocked in each of the Omni-cells. That's where you want to pull from to make sure that it's tinted. An extra pack of 4x4 gauze, again for securing the chest tube site or for the surgeon. And then you're going to select which size chest tube that you need. It's important to know that they vary in sizes, so 12 French is the smallest size chest tube that we have, up to 36 French, and we also have straight chest tubes and trocar chest tubes. So you're going to want to ask the provider what size and what type of chest tube that they actually want. So we'll just go ahead and say, Alyssa, I want a 32 French straight chest tube. And you would pull it out and get it ready. You're not going to do anything with this until the surgeon tells you that they're ready for it to be dropped onto their sterile field or opened up, and they're going to pull the actual chest tube out when they're sterile. So you would just go ahead and set that up here next to that. Say you want a pair of 7.5 size sterile gloves, you would go ahead and pull those out. And it's best if you just go ahead and set up your sterile PPE equipment right on this back table. Then you're going to grab an extra pack of 4x4 towels. I don't actually know what size they are. You're going to grab a sterile gown. You're going to grab a sterile sheet. And then you're going to grab a face mask and a hat. It's important to know that anybody working in this sterile field has to have a face mask and a hat in. It's also important to know you need to be mindful of this sterile field. This is a sterile procedure. In emergent situations, it's as sterile as we can make it. But you want to be mindful that these rooms are very small. When the surgeon has a sterile field set up, you want to make sure that you're not brushing up against any of the equipment and staying back as far away as you can. So once you have all these supplies out, your provider can don their PPE, and we can work on setting up the chest tube atrium. So when you pull your chest tube atrium out of the bag, it's going to look like this just right here. It's important to go ahead and move your foot prop so that your chest tube chamber is stable and it doesn't tip over. This is the side that actually connects to the patient. At any point during this procedure, if you're say it's an emergent situation and your surgeon or provider is already ready for you to hand this to them, you can do this at any time, regardless of whether you have your water in here or not. You simply are going to remove the tip and hand this to the provider to attach to the chest tube in the patient. So for our role in setting up the atrium, here is the tubing that we're going to fill our water chamber with. So Alyssa's going to demonstrate exactly how to fill up the water chamber. This is pre-measured filter for you, so you're simply going to fill it to the top of this filter, and then you're going to undo your stopcock and allow that area to fill. And you're going to know you're in the right spot if the water level is to the level of this blue arrow right here. It's then easy to just go ahead and remove that filter to use it to fill up your suction chamber right here. And again, you're going to fill it up for an adult patient to 20 centimeters. If you have a child or an infant, you would want to fill that level to the order of the provider. So once you have this filled up to 20 centimeters, you're actually ready to put this over to suction. So we'll move over here to the suction area and get it hooked up depending on what side the chest tube is going to be placed on the patient. So when you are setting up your suction chambers in the morning, it's important to go ahead and add extension tubing to your containers so that they can actually reach over to the patient. And you're going to actually set the suction to low continuous because you're going to actually control the level of suction to the patient by this stopcock valve over here. So once it's hooked up, you're going to start to undo it until you have just a gentle bubble in your chamber over here. As you can see, this is going to start to go, and then you're going to control that by that area right there. Again, these are extra little things that you can adjust as you get the patient all situated. Not emergent to be done right away. But as you have a gentle bubble over there, again, you're ready to be hooked up to the patient. Now, it is very important to note that this chest tube comes with a clamp on it, and you never want to clamp a chest tube on a patient. This would cause a pneumothorax to happen and would be very bad for the patient. So always be mindful of this clamp, that it is never clamped when this is attached to the patient. It is also very important to note that you never want to tape this chest tube chamber to the ground. It does have some hooks here that you can attach it to the bed as you're traveling to radiology or other areas in the hospital. But again, never tape this to the ground. It's also important to note that in an emergent situation, the provider or surgeon may want to needle decompress the chest if there's a tension pneumothorax. So if they ask for a decompression needle, that is located right here in this top section, and it is titled decompression. It's a 14 gauge, 3 1/4 inch angiocath that they would use to needle decompress for a patient that has a tension pneumothorax that is decompensating rapidly and there's no time for a chest tube. So you would place this and then prepare for your chest tube setup. Anytime there's a needle decompression, it's always followed by a chest tube. Then when their surgeon gowns their sterile gown, your job is to allow them to maintain sterility. And there is a card on the front of this gown that you are going to hold. The doctor's going to twirl. There we go. You're going to have to just cut.